Doctors in Senegal tend to patients in this single-story building. Dotted around sparse rooms, the patients struggle for breath. They're aided by oxygen hissing through plastic tubes and a small team of doctors and nurses. This is the reality inside Dakar's Fan Hospital, where all the intensive care beds are occupied and health officials say only the most severe COVID cases can be taken in. A second wave of new infections and deaths in Senegal hit record highs this month, threatening to overwhelm a health system that lacks the resources of richer nations and forcing President Macky Sall to reimpose a state of emergency that bans gatherings and enforces mask wearing. Medical staff hope that will buy enough time to install new facilities and reopen health centres.
We
can say that we are a bit worried because we are here every day. We can say that sometimes there is fear, there is panic. Moreover, we are more concerned for our families than ourselves because here we can take all the proper measures, but once we are home, we are afraid to infect our families, our children.
A multi-story clinic with 70 rooms has been built nearby and will start receiving COVID patients in March in a ward with an air purifying system and ventilators. In all, the country has more than 40 treatment centres, 60 intensive care beds and 300 health workers trained to deal with COVID-19 patients. Senegal is awaiting vaccines through the World Health Organization-backed global COVAX scheme. The health minister said it is also hoping to buy extra doses. But its vaccine options are limited, with no capacity to store vials at ultra-low temperatures. The country currently keeps thousands of vials of yellow fever and hepatitis B vaccines in cold rooms like these in the capital Dakar at between 2 and 8 degrees Celsius. Technicians at the Fan Hospital are installing 7 new such rooms to keep the coming COVID vaccines nearby. But for now, the lack of deep refrigeration limits the country's options and puts the onus on prevention and frontline care.